Assalamualaikum and a very good morning to all. I'm Nazmi. I'm the representative of Group 21 who would like to present about incidence, clinical characteristics and outcome of Tropidolaemus species bite envenomation in Malaysia, consulted to Remote Envenomation Consultancy Services from 2015 to 2021. This study is conducted under Emergency Department, which is supervised by Prof. Madya Dr. Ahmad Khaldun Ismail. As an introduction, Remote Envenomation Consultancy Services (RECS) is a specialized risk management support system that assisted all healthcare clinicians at all stages of clinical management for snakebite as well as bites and stings or poisoning from other organisms. There are more than 200 species of snakes in Malaysia, with approximately 20% being medically significant. Among the pit vipers in Malaysia, the Tropidolaemus species is one of the common causes for venomous snake bites. There are two Tropidolaemus species, Tropidolaemus wagleri, indigenous to Peninsular Malaysia, and Tropidolaemus subannulatus is indigenous to Malaysian Borneo. This is the adult female and adult male of Tropidolaemus wagleri. This is the adult female and adult male of Tropidolaemus subannulatus. In both species, the juvenile Tropidolaemus features look the same. As they mature, males and females morphological changes. In WHO guidelines for the production, control and regulation of snake antivenom immunoglobulins, Tropidolaemus subannulatus are included in Category 2, which are highly venomous snakes that are capable of causing morbidity, disability, and mortality, in which the clinical data are still lacking and less frequently implicated. This study provides the evidence for revision of Tropidolaemus subannulatus from the WHO Category 2 list of medically important venomous snakes in Malaysia. The general objective of this study was to document the characteristics and significance of Tropidolaemus species bite envenomation consulted to RECS from 2015 to 2021. The specific objectives of this study were to determine the incidence, geographical distribution, clinical features, clinical management, and the outcomes of Tropidolaemus species bite envenomation in Malaysia. The hypothesis, Tropidolaemus subannulatus cases, is more frequently consulted to RECS compared to Tropidolaemus wagleri cases from 2015 to 2020-21. Tropidolaemus species bite occur more in the non-urban area compared to urban area. No patient bitten by both Tropidolaemus species developed coagulopathy. No patient bitten by both Tropidolaemus species is indicated for antivenom. All the patients bitten by both Tropidolaemus species discharged well without prolonged hospital stay. This is a retrospective cohort study. Ethics committee and RECS approval were obtained prior to data collection. The data of snakebite consultation was retrieved from RECS consultation log and recorded using standardized data collection sheet. All data were kept anonymous and confidential. All confirmed Tropidolaemus species bite cases in Malaysia consulted to RECS from 2015 to 2021 were included, and other species and unidentified species bite cases were excluded. There were a total of 5,820 RECS consultations during the study period. Out of this, 81% were snake-related injury, with 45.9% classified as identified. There were 310 confirmed Tropidolaemus species bite cases. 61.3% were Tropidolaemus subannulatus, and 38.7% were Tropidolaemus wagleri. The graph shows an increasing in trend of Tropidolaemus bite cases over the 7-year period. Based on this table, majority of patients were Malaysian, male, between the age of 40 to 59 years old. Most of the cases were non-occupational. Most incidents occur between noon and 7 p.m. in outdoor settings. Greater exposure to outdoor activities and the patient encroaching into the snake's habitat may contribute to this finding. The majority of consults for Tropidolaemus subannulatus cases was from Sarawak and Tropidolaemus wagleri cases was from Perak. Most patients are bitten once and the highest number anatomical region involved was upper limb. The majority of patients perform inappropriate first aid intervention prior to hospital arrival. Among the inappropriate first aid, tourniquet was the commonest. Most common presenting symptoms and signs were local pain and puncture wound. Antivenom is not indicated for Tropidolaemus species. Two cases of inappropriate antivenom were administered without any complications. Antibiotics is indicated in the case of patients developing secondary infection. Two cases where intravenous cloxacillin were administered without proper indication. No cases that requires any surgical intervention such as wound debridement, fasciotomy, and amputation were reported. Most patients presented with mild pain and the most analgesics used was paracetamol. Type of analgesics used positively correlated with patient's pain score. Most patients stay less than 24 hours in hospital as there was no serious envenomation side effects. No cases of morbidity and mortality recorded. Most cases involve patients being bitten once. Tropidolaemus species only strikes when provoked, disturbed, or accidentally stepped on. This shows defensive nature of Tropidolaemus species instead of an aggressive snake. Majority cases were bitten on the upper limb shows the arboreal nature of Tropidolaemus species. However, lower limb also has high cases which because of the patients accidentally step on the snake. Most cases occur during daytime. This contradicts with the nocturnal nature of snakes. This may be due to higher human activities during the day. Lastly, the location of incident happened more at orchards, farms, and plantation, which correlates with habitat of Tropidolaemus species, which is wet lowland forest area. Tropidolaemus species bite only cause mild to moderate local envenomation such as local pain, puncture wound, localized swelling, and erythema. Vasoactive substances and enzymatic toxins cause local effect. No life-threatening systemic envenomation in all patients were identified. No cases of tissue necrosis, cardiovascular instability, or coagulopathy. Antivenom is not indicated for Tropidolaemus species by envenomation. Supportive management is the management of choice. Analgesics use correlates with patient's pain score. Antibiotic is not indicated if no secondary bacterial infection. No mortality and no morbidity reported in our study. No life-threatening systemic envenomation were documented. WHO Category 2 listing should be revised to exclude Tropidolaemus subannulatus for Malaysia. Our research was only limited to confirmed cases of Tropidolaemus species bite in Malaysia consulted to rats. This study did not analyze all Tropidolaemus species bite cases in Malaysia. However, it provides good representation. Possibly, there are more Tropidolaemus species cases classified as unidentified snake-related injury. This study also did not analyze post-discharge patients' progress. However, all patients discharged well and to come again when necessary. For future studies, we recommend research for future analysis to involve all hospitals in Malaysia. We also would like to further research on venom components and its toxicity of Tropidolaemus subannulatus. Research on developing snakebite identification kit would be beneficial in the future. As a conclusion, appropriate, adequate knowledge and skills regarding snakebite management is important, which includes proper species identification and appropriate diagnosis for optimal management. Majority of Tropidolaemus species bite envenomation cause mild local symptoms and do not require antivenom. Clinical management, analgesia, close serial monitoring, and short hospital stay are recommended. Tropidolaemus subannulatus should be excluded from WHO Category 2 list of medically important venomous snakes in Malaysia. This is our reference. Thank you.